Part 2, Communication Disorders, acronym CD. Definitions by Dr. Marty Harris. This presentation includes audio that reads the slides. Therefore, closed captioning will not be used. From biblical times to the Middle Ages, people with speech disorders were considered fools, buffoons, and a source of entertainment. In 1910, Chicago schools hired 10 speech correctionists. By 1950, many school districts had speech correctionists to work with 150 to 250 students. In the 1970s, the new research on language defined the 5 dimensions of language. During this time frame, speech correctionists became speech therapists and began to address language impairments. Terms for the field of CD. Speech and language impairments, acronym SLI. Secondary language disorder. When does a communication difference become a communication disorder? Speech disorders, language disorders. IDEA 2004 definition of SLI. A speech or language impairment is a communication disorder such as stuttering, impaired articulation, a language impairment, or a voice impairment, which adversely affects a child's educational performance. Definition of a secondary language disorder. Some children may have difficulty learning and using spoken language as a result of another disability, such as an intellectual disability, an emotional or behavior disorder, a learning disability, or an autism spectrum disorder. When does communication difference become a communication disorder? Transmission of the messages is faulty. Person is placed at a disadvantage, economic disadvantage, learning disadvantage, social disadvantage, social, emotional, or self-esteem. Problem causes physical damage or danger. Types of speech disorders. 1. Articulation disorders. 2. Voice disorders. 3. Fluency disorders. Speech disorders. Number 1. Articulation disorders. Atypical sound production. Largest group of speech disorders. Substitutions and omissions are most common. Remember that at certain ages, articulation errors are developmentally appropriate. There are 4 types of articulation disorders. A. Substitution. B. Omission. C. Distortion. D. Addition. Speech disorders continued. Number 1. Articulation disorders continued. Substitution and omission are the most common articulation errors. Substitution, example, doze for those. Most common substitutions at the beginning of words include W for R. Example, wabbit for rabbit. T for C. Example, tat for cat. B for V. Example, Ballantine for Valentine, and F for TH. Example, free for 3. Omission. Example, cool for school. Because blends are later in developing, many omissions errors have the second sound in the blend omitted. Example, boo for blue. Example, pity for pretty. Final sounds also are commonly omitted, particularly the later developing sounds such as S, SH, Z, and the voiced and voiceless TH. Distortion. Schlep or sleep for sleep. Addition. Hamber for hammer. Speech disorders continued. Number 2, voice disorders. Voice disorders are inappropriate voice quality, loudness, or pitch. There are 2 types of voice disorders, phonation and resonance. Phonation, the voice sounds breathy, hoarse, husky, or strained, or no voice in severe cases. Resonance, too many, hypernasality, or too few, hyponasality, sounds coming through the air passages of the nose. Voice nodules on the vocal cords are the most common. Speech disorders continued. Number 3, fluency disorders. Fluency disorders are interruptions in the natural smooth flow of speech with inappropriate pauses, hesitations, or interruptions. There are 3 types of fluency disorders. A, stuttering. B, cluttering. C, apraxia. Speech disorders continued. Number 3, fluency disorders continued. A, stuttering. Repetitions of consonant or vowel sounds, especially at the beginning of words, and complete verbal blocks. 98% of the cases of stuttering begin before age 10. More than half of all the children who stutter during the preschool years recover before the age of 7 years. B, cluttering. Very rapid speech with extra sounds or mispronounced words. Speech is garbled to the point of unintelligibility. C, praxia is a motor speech disorder. Cannot put together the movements and patterns required to speak. Usually understand language very well. The disorder is one of expression. Types of language disorders. 1, phonological disorders. 2, morphological and syntactical disorder. 3, semantic disorder. 4, pragmatic disorder. These parallel the 5 dimensions of language. Language disorders. Number 1, phonological disorders. Able to produce a sound, but inconsistent errors. Problems in processing sound. Other language delays are likely. Language disorders continued. Number 2, morphological and syntactical disorder, difficulty using plurals, difficulty with tenses and/or verb usage, difficulty with pronoun usage, difficulty using a, an, the, other grammar errors. Language disorders continued. 3. Semantic disorder, difficulty learning new words or using new words when appropriate, difficulty making sense out of stories, difficulty retelling a story or event, problems with sequence. Language disorders continued. Number 4, pragmatic disorder, difficulty using language in social situations, unable to make their needs clear to others, difficulty formulating questions, poor concept formation. Other language disorder terms. Aphasia refers to the loss of language after it has been developed. Usually, the loss is the result of TBI, traumatic brain injury, or some other type of injury. Can range from mild to severe, can impact receptive or expressive language, or both. Central auditory processing disorders, acronym CAPDS. These students do not have a hearing loss, have difficulty processing sounds, trouble with listening and speaking using the rules of language. Some experts view CAPD as a learning disability or ADHD or specific language disorder. Some students will communicate using augmentative communication technology. Some students learn to use eye gaze to communicate. Everyone wants to talk, so make education special. References: Friend, 2011. Hallahan, Kaufman, and Pullen, 2009. Eward, 2009. Smith, 2010. Taylor, Smiley, and Richards, 2009. Turnbull, and Waymeyer, 2010. Copyright for this presentation is by Dr. Martha Harris, 2017, 2010, 2005, 1998. Thanks for listening.